Coming up today, a retired firefighter faces prostate cancer, how he and his doctor work together to find the best treatment. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we are talking about a cancer that affects 1 in 8 men, but often goes unnoticed until it demands attention. Prostate cancer can be slow growing, easy to miss, and in many cases, though, highly treatable if caught early. Our guest today is a retired firefighter who spent decades putting his health and life on the line for others. But before we get to his story, let's get to our morning rounds. When was the last time you had your skin cancer check? If you're overdue, doctors and med students are doing skin checks for free this weekend in Kansas City, Kansas. That is thanks to the JDoc Clinic and the Masonic Cancer Alliance. Joining us now is Dr. Gary Doolittle, skin cancer expert and the medical director of the Masonic Cancer Alliance. Dr. Doolittle, good morning. Always good to see you.
Good morning, Jessica. Great to be here.
Good to see you. Well, who should be getting skin cancer checks and how often? Actually,
any adult should have a skin check at least once a year. We encourage it. And then if for some reason you're at high risk for developing skin cancers, your dermatologist or your primary care physician will let you know that you need more frequent checks than annually.
All right, and thanks for the reminder because I'm up for mine. I'm due for mine for sure. Details for this weekend's events are on the screen. It is again this Saturday afternoon tomorrow at Vibrant Health Clinic on Southwest Boulevard in KCK. That QR code will take you to a registration website. Dr. Doolittle, for those who have never had a skin check before, what all is involved? About how long does it take?
You know, it really depends. If it's a skin exam that's relatively normal, it may take between 5 and 10 minutes. If it's a patient that is high risk for skin cancer or has had a family history of skin cancer, the physician may take more time, 30 minutes, 40 minutes, but it's really time well spent. This is the most common cancer, over 3 million cases a year, and it's very treatable if we catch it early. So whether it's 5 or 10 minutes or 30 or 40 minutes, it's really time well spent.
Yeah, well worth the time. Okay, so if someone cannot make this free event this weekend, what can they do if they want to get a skin check? How do they go about booking that? Where do they go?
I would encourage any patient to contact their primary care physician for a skin check or a dermatologist. They may have a known dermatologist within the family or have friends that get in. You know, call, make the appointment. It will be time well spent.
Dr. Doolittle, always great to have you. Thank you.
Thanks, Jessica.
Well, like many men, Jack Holcomb assumed his good habits and clean bill of health would carry him out throughout retirement. But an elevated PSA and some persistent symptoms changed everything.
I'm like, this is getting old. I don't like. I used to jump out of windows and climb ladders.
For nearly 4 decades, Jack Holcomb served as a firefighter.
I started in 1979. We didn't even have air packs for everybody. Then as the years went by, things started to come to light about health, not until probably the 90s or so, early 2000s, health and wellness. And it was a little too late then.
By then, Jack had already lost several firefighter friends, not on the job, but to various cancers brought on by environmental toxins doing the job.
We have a small group just from our department that have all been diagnosed with some type of cancer.
Guidelines changed and firefighters were required to have annual physicals, regular blood work, and their PSA check. When Jack retired and stopped working in 2014, he admits his screening stopped too.
It's like the military. You're told to do something, you go do it. And then when I'm on my own, I didn't do so well.
No longer able to ignore the frequent urination, Jack just had a feeling. He finally saw a urologist, and the news was what he had suspected. He had prostate cancer.
I felt like the urologist I went and saw was really kind of pushing me towards doing the robotic surgery, the removal of prostate.
Jack wasn't so sure about that, so he referred himself to Dr. Ronald Chen at the University of Kansas Cancer Center, who had another option, SBRT, stereotactic body radiation therapy, a type of high-dose radiation treatment used for some early-stage cancers.
He said that an option of, instead of spreading the radiation out, we just do it in 1 week.
And just like that, Jack was back to what he calls quality of life, like making memories with his daughter.
She's like, I want you to spend my birthday with me. I'm like, sure, what are we gonna do? Well, we're gonna go skydiving. So we went skydiving.
Yay!
We went on another trip just a couple months later, so everything's been good, been great.
And reminds us all of this.
I look at it a lot different. I go to the doctor, I ask questions. We're not bulletproof.
And joining us this morning is Jack Holcomb here in our studio. Good to have you.
Thanks. Glad to be here.
Glad to have you. Also, we have Dr. Ronald Chen, the Chair of Radiation Oncology here at the Cancer Center and the leading expert in treating prostate cancer. Always good to have you, Dr. Chen.
Hey, Jess.
We also have in Studio B with us Kate Martineau, a nurse practitioner in the Department of Radiation Oncology, joining us from Studio B. Katie, how are you?
Good. Thanks for having me.
Good to have you. Together, we're all going to discuss really how far we have come in treating this disease. We're also going to talk about what every man should know about screenings and why quality of life is just as important as finding a cure. Jack, you mentioned brushing off that initial call about your elevated PSA. What was going through your mind at the time?
I was surprised. My PSA had always been normal, low, and I was a little shocked. Didn't know if I really needed to move forward with anything.
Yeah, because you've been really, diligent about getting it checked and staying up on it, right?
Right. Yeah.
Dr. Chen, for men like Jack, they have an elevated PSA, but they feel healthy. What's your message about why follow-up matters?
Yeah. So I think the principle here is we want to catch a cancer before it causes symptoms. We want to catch it as early as possible. And prostate cancer, fortunately, we have that PSA test that's able to sort of alarm us that something may be going on before a patient develops symptoms like blood in the urine and whatever. And of course, as early as we catch it is when it's most curable. So my message is, if your PSA is elevated, get a biopsy, pursue it, don't delay it, because the early diagnosis means saving your life.
So could you tell, though, that Jack had put it off for a while when you met with him?
Actually, I think Jack has done a really good job. Jack's PSA was elevated, but not extremely so.
Mm-hmm.
Of course, as a person who specializes in prostate cancer, I've seen a lot of men who have really delayed it over the years. And I think part of it is fear. You have a blood test that's elevated, say something is wrong, you feel good, you're afraid of what a biopsy may show, so you wait for the next year, and then you wait for the next year, and then you wait for the next year. I've seen many situations like that, and I think that's really something that we should try to avoid.
Yeah, and that's tough because, when you're feeling good, you're feeling good, right? You're always told, listen to your body. So let's turn now and let's talk about those signs and symptoms of prostate cancer, because in early stages, you may have no symptoms at all. And that's why the screening is so important. Some men experience problems urinating. They might have blood in their urine. Jack, what symptoms were you experiencing at the time?
Well, I went from not being an issue about urination to I was getting up 4 or 5 times a night. I was feeling sudden urges during the day, unexplained, that like immediate. And I just had an overall feeling of something wasn't right.
Something wasn't right.
Yeah.
Katie, I want to ask you, prostate symptoms, as we know, they can be awkward or embarrassing to talk about. How do you normalize the conversation with men, make sure that patients are feeling comfortable in sharing everything with you?
Yeah, of course. So prostate cancer oftentimes brings up very personal concerns such as urinary or sexual health issues. So the first thing I really try to do is to get to know the patient, try to create a personal rapport. Jack knows this. Sometimes you come in and we're just talking about family, travel, the chiefs, of course, getting to know each other. And then I always try to make sure, we talk about how all of these symptoms are very common. They are normal. There's nothing to be embarrassed about. Every time you come to a follow-up appointment, I am going to ask all of the side effect questions. I think that really kind of lowers the barrier to entry. If I ask the question, I find that people will often be a little bit more truthful and bring them up. And my goal is just to create a safe space where every question can be asked openly, and then that way we can give the best care and support.
And why is it so important to get to the truth? And how can that impact treatment?
Yeah. So I think that if we don't know what's going on, we just can't help you. I have had patients, so I see mostly follow-up patients. And I have had patients who have suffered with things that they didn't need to suffer from. I have had patients who have put off that once-in-a-lifetime trip because they were afraid they couldn't do it because of their symptoms, when really we had a really easy treatment that we could provide. So please let us know what's going on. So once we know, we can really start the care and the treatment that you need.
Jack, was it easy, hard talking about it? How did you kind of navigate those first initial conversations, and did it become easier over time?
Yeah, great question. The first ones were very uncomfortable.
Sure.
Dr. Chen made it feel very comfortable. I and my wife, and Katie's been great. So now it's just old hat when I see Katie, very open. But yeah, it was uncomfortable, something a man normally doesn't talk about with others.
Well, and thanks for sharing that, because that's why we have these conversations here openly, so that other men, when they eventually have to have these conversations with providers like Katie, that they feel comfortable doing that, right, Dr. Chen?
Yeah,
I mean, we want men to feel comfortable talking about it, because it can affect their treatment path.
Oh, absolutely. And I think, just to be more specific, I think a lot of times we talk about what are your urinary symptoms, and we're very specific, going through a list of them. We talk about sexual function. I think sometimes people are a little comfortable talking about that, but I think Katie and I, when we see patients, we're very direct with, this is why we're asking you these questions. Please tell us how you're doing right now, so we can sort of track that over time. And I do think that, practice makes perfect. Katie and I specialize in prostate cancer. We do this all the time, and I think our comfort asking these questions helps patients feel more comfortable talking about them with us.
Something very important, screening guidelines. Let's talk about those. It begins at 45 years old for average risk. The age for screening drops to 40 years old for Black men and men with a family history. It's 40 years old for men who have several family members with a history. PSA testing remains the main screening tool. And Dr. Chen, what about digital rectal exams?
I think a lot of people have heard that PSA is not a perfect test, and that is absolutely true. It is the best we have. It is a really good tool to screen for prostate cancer, even though it is not perfect. And what I think part of the imperfection is that even a normal PSA, sometimes people could have prostate cancer even with a normal PSA. This is where the digital rectal exam can come from. About 10% of prostate cancer is actually caught on digital rectal exam when you feel something abnormal in the prostate when the PSA is actually normal. And so I think an ideal screening would include both the blood test PSA and the digital rectal exam, because again, DRE can catch some cancer the PSA misses. But I would also say that some men are just uncomfortable having that exam. And if that's the case, still get a blood test, because that still catches the majority of prostate cancers.
Katie, anything else we should know about PSA tests?
I think exactly like Dr. Chen said, just please get your PSA test, know your number, and then we can go from there.
Should men with long-term environmental exposure, like firefighters, consider earlier or more frequent PSA testing?
That is not part of the guidelines. I think there could be some exposures that increase the risk, but there's not enough evidence to support increasing the frequency of screening for those men being beneficial. So we do not currently recommend that.
Jack, tell us the history, though. How did cancer awareness change over the course of your firefighting career? Because I know this is something you're certainly excited about, the changes for this current generation and generations to come.
Yes. In the beginning, it was never anything mentioned. Our gear remained dirty that we wore in all kinds of commercial, residential structures. We often took off air packs, our masks a little too soon, and inhaled toxins. But about the 90s, it became aware with the help of the International Firefighters Union pushing for health initiatives, and into the 2000s. And I worked for a very progressive department that is very supportive of that, and the city that funded that for the blood tests, the physicals. Now it's second nature, and it's saving a lot of lives.
And you've lost some friends. What has that been like for you over the years? Because you said I felt like I'm up next.
Yeah. So yeah, it's well known that it's a hazardous occupation. There's a lot of hazardous occupations, a lot of exposures in occupations and lifestyles out there, and this just kind of hit home, kind of like brothers. They were so strong, saw them being so physical, and then to have cancer hit. So that was an eye-opener. And then even now's retirement, fellow firefighters. We chat, ex-firefighters, and find out, oh yeah, you got diagnosed? Yeah, you went through treatment. So it's pretty common.
And you said you have a little group that visits?
Yeah, we initially, we contacted each other. It's like, well, what are you going through? What did you find, and what happened to you, and how did it go for you? So, yeah, we compared notes.
Certainly not something you thought you'd be talking about,
No.
20, 30 years ago.
Didn't look forward to that, no.
Sure. I want to talk about Jack's treatment. Dr. Chen, he had the option of robotic surgery that he had talked about before he met you, before he sought you out, or radiation. What are the main differences between those approaches, and how do you help patients make that decision?
Yeah, I think patients when the prostate cancer is caught early, like Jack's case, I think patients are in the fortunate situation of being able to actually choose surgery or radiation as treatments that can really have a high chance to cure the cancer. And I use the word cure purposely. When it's caught early, we can cure prostate cancer with a very high probability. And in early prostate cancer, surgery and radiation are considered equally effective. There's been a clinical trial comparing surgery, comparing radiation. They have followed these patients for 15 years or more, and the results are absolutely the same in terms of cure and recurrence and metastasis. So really, we think of these as two major curative options are equally good. So how do we help patients make a decision? I think Jack did a great job in seeking a second opinion. When you have two equally good options, you want to hear from a urologist talking about, this is what surgery is like, this is the effect, this is the recovery, the side effects. You want to hear from a radiation oncologist talk to you about, here are the different types of radiation, here are the effects, here's the recovery, here's the side effects, and then so then you can make an informed decision. So I usually encourage multidisciplinary consultation, talking to a surgeon or radiation oncologist, so the patients can make the best decision for them.
And Jack, what helped you choose radiation therapy over surgery? Because I think you had said you just did not want surgery. You'd made that decision, right?
Yeah, I wanted to do the least invasive, in my opinion. That had been my experience in the past with medical things. But just like Dr. Chen said right here, that's exactly what convinced us to go with him. He was very open, very honest about the comparisons. Even the cost was similar. I asked him of that, and he did a great job of explaining. And he could see, I believe, my reluctance. I had a trip to Jamaica planned coming up, and I was like, well, we got to put it off a little while. I want to go on this trip. He was very open to that. So just like he said here, is exactly why we decided to go.
Yeah, you said he was very matter of fact and willing to figure it out with you.
Yes.
Work with you.
Absolutely.
And Dr. Chen, explain how the timeline is possible, because normally radiation is spread out with daily treatments over several weeks. That's what we think of when we think of radiation treatment. But in Jack's case, he only needed a single week of treatment. How is that possible?
I think what ultimately makes this possible is that the technology, the accuracy of radiation has increased so much over the last 10 to 20 years. I often see patients who say, well, my father had radiation 25 years ago, and this is what it was like. Well, it's not like that today at all, just as technology has evolved. And with more accurate targeting of radiation, we can actually shrink low doses over 9 weeks of radiation to higher doses over a week, because we can target the prostate so accurately. And I would say that 10 years ago, prostate cancer was everyday radiation for 9 weeks. There may be still some groups in the country that kind of practice in that old way, but we have a lot of patients now here in Kansas City at our cancer center who choose the 1 week because it is more convenient. It is equally effective, if not more effective, than the longer course radiation, and it is highly precise and really with great long-term outcomes. And so I think technology improvement, having that to be able to offer to our patients, has really improved the patient's quality of life.
Jack, any side effects before or after, during or after treatment?
You know, nothing drastic, no. I mean, during treatment and stuff, I felt about the mid of the week when I'd rush home afterwards, and it was in June, hot, go outside, try to do a lot of yard work. I felt it was a little draining on me, but that could have been psychological. Afterwards, nothing immediate. Meeting with Katie, follow up and stuff. Just a reduced stream and urination stuff, but she was great talking through that and helping me out. No, I mean, I seemed to bounce back pretty quick.
Pretty good. Katie, what are the most common side effects that you see with patients, and how do you help them manage those?
Yeah, so the most common side effects after prostate radiation would be like urinary changes such as frequency and urgency, bowel changes, and sometimes sexual side effects. The good news is that most of these are manageable and temporary. And so we have a lot of different treatment options for patients. Sometimes it's just some lifestyle and diet changes. Sometimes we send people to like pelvic floor physical therapy. We have a great group here at KU. And then we have medications. And so we really just kind of talk to the patient, figure out what their goal for treatment is. And then we just provide that ongoing support throughout every step of treatment and then beyond treatment.
Be sure to ask your questions. You can use the chat on YouTube or Facebook, or you can email the Medical News Network. All of that information is right there on your screen. What kind of follow-up do you have now, and has that affected your day-to-day life?
No, I mean, I meet with Katie about every 6 months. I'm probably a difficult patient. There's travels I have or other plans that pop up, so I have to change my appointments, but they've been great about that. They've been excellent. But that's basically it. I'm more aware of my health, and I guess Katie may say that I maybe have a long list of complaints or stuff. Maybe has nothing to do with my treatment, but no, it's been great.
Katie, what's it been like working with Jack?
Oh, it's been a lot of fun. I think we've gotten to know each other really well, you know, and he's one of those patients where when I see him on the list, I'm excited to get to talk to him. You know, we're always going to catch each other up on travel or family. And part of the fun part about this whole thing is that now that we're pretty far out, you know, sometimes we're not even talking about side effects anymore. We're just talking about the day-to-day, and that's when it becomes really exciting to see your patients as they progress through this.
I bet it is. Well, let's talk about family, like your daughter and this wacky thing she got you into, like jumping out of airplanes and skydiving. Yeah. Is this? Let's talk about this skydiving you did with her for her birthday. What did this moment mean to you?
Well, it was September 1st, that year follow-up after the radiation, and that summer, and I was feeling a little kind of maybe not as manly as I had been, you know, after this and this coming to light, and family members knowing about it, even though my wife and family were very supportive. And my daughter said, "Hey, I want to spend my birthday with you." I thought, well, that's great, you know, let's go, you know. And then she goes, well, I want to go skydiving. So yeah, we did.
That'll make you feel pretty manly, jumping out of a plane.
Yeah.
That's something that Dr. Chen and I will not be doing.
I was commenting before this show that I will never go skydiving.
Yeah, and Jack said, he goes, you should try it. I said, not happening. It is not happening.
No thanks.
So you've got us there, Jack, okay? Dr. Chen, what stands out with you, besides him jumping out of an airplane, what stands out to you about Jack in his case, medically or just personally?
Well, I think Jack, and thank you for doing this to raise awareness about prostate cancer. I think Jack's case is actually a pretty standard case that shows that with early diagnosis, if you have the courage to, you know, get your PSA check, get a biopsy, if it's caught early, you can have a curative treatment and kind of go on with your life. This is the success story, and actually it's very common if we catch it early. You can have treatment, it's a highly successful treatment, you can go on with your life and live it in a very good way. And so I think hopefully Jack's story will encourage other people to be able to stay on top of their screen and catch it early.
Before we get to questions from the community, I do want to go over some risk factors, though. There are many risk factors for prostate cancer. Chances increase increase as men age. So, of course, screenings generally, as we mentioned, begin at 45. Your race plays a role too. Black men are 70% more likely to develop prostate cancer than white men. Your family history is an important factor, so know it. And we are learning more about the role of gene mutations like BRCA1, BRCA2, and if you were in the military, that increases your chance of prostate cancer due to possible exposures. Dr. Chen, though, is there much that men can do to lower their risk of developing prostate cancer? What are the lifestyle things that we can do?
Yeah, so actually, there's a lot of research. Of course, there's a lot of interest in doing things to prevent cancer. Unfortunately, in prostate cancer, there is no definitive research to show that doing this will absolutely decrease the risk. So currently, we do not have a definitive recommendation on what you can do to lower your risk. However, most reputable websites will encourage better diet, less red meat, more vegetables, more exercise, as things that may reduce the risk of cancer, and more research is needed.
Let's get to some questions from our community. Jeremy wants to know, you talked earlier about the frequent urination at night. Are there other symptoms as well to be on the lookout for?
Frequent urination at night could be a sign of prostate cancer, but honestly, it's probably more likely to be a sign of an enlarged prostate, which happens as men age. And so just because when you were maybe in your 20s, you never got up at night, and then when you became 60, you got up once or twice a night, that happens with age. That happens as prostate gets bigger with age. That is not necessarily a sign of prostate cancer. I think it could be, but most likely due to an enlarged prostate.
Lynn wants to know, could PSA be used to early detection for prostate cancer?
Yeah, PSA is the primary way to try to have early detection of prostate cancer. We recommend that men over age 45 or 50 to have a PSA checked once a year, mostly by your primary care doctor. That is a primary way how we can catch it early.
Jack, thank you so much for just being willing to share this personal part of your life and your story. That makes a big, big difference. What's the big takeaway from your story? What do you want people to know?
To heed what you hear from the doctors repeatedly, get checked early, follow up. It's easier to handle it when it's at the early stages, and then prevention is better than trying to deal with a cure. But it wasn't painful, any of the process, and it wasn't difficult, and I owe it all to Dr. Chen and Katie. So thank you.
Thank you. Katie, what's the big takeaway today?
Yeah, I think if anything, just please get your PSA checked, know your number. Of course, we don't want to see anyone, in our office with a prostate cancer diagnosis. But if you do get that diagnosis, please come see us. And just let us help take care of you.
Thank you so much, Dr. Chen. Wrap us up on this Friday.
I think Jack's example of seeking a second opinion, I think, is so important. When you have a cancer diagnosis, the first doctor you see may have a recommendation which may be really good, but cancer is such an important diagnosis and such an important decision. Get a second opinion, see if there's other options that you may not have heard about before you make a decision, because that's a life-changing decision for the rest of your life. So second opinion when you have a cancer diagnosis, I think that's my takeaway.
Always great to have your insight. Thanks to all of our guests for being here with us today. Thanks to our viewers for joining us. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update. For athletes, what happens off the field can be just as crucial as game day. I'm Jessica Lovell on the next Morning Medical Update. We take a closer look at what happens when two high school athletes spend their summer training at the University of Kansas Sports Medicine and Performance Center. And spoiler alert, these workouts are about more than just building strength. That's Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.